Okay, so real quick, the hip flexors are made up of several muscles, and they actually go down the thigh, into the inner thigh, and even around the hip. So it's a complex area and easy to get strained, especially as a baller. So these are exercises that you'll want to do every day to prevent this from happening, or if you actually have a strained hip flexor, they will help provide recovery, and they are therapeutic. So you can run through each of them. Every single day is optimal for sure, and it should take you like 7 minutes. You can do it twice through, take you a little longer. First exercise you're gonna do is lying flat on your back, and you're gonna cross one leg over the other. It's called figure 4 hip stretch. And if this feels painful, do not do it. Always rate yourself, scale of 1 to 10. 1, no pain, 10, excruciating. So these exercises should not create anything above a 7, even a 6. So if you're experiencing 6 or 7 on a pain scale, remove it. That means you need more therapy with other exercises, and perhaps also see a physician, and you may require physical therapy as well. So if you can cross pain-free, you're gonna lift up and down, up and down. You want to get about 10 on each side, and that's actually going to warm you up a bit, okay? So even if the hip flexors are bothering on one side, you want to make it even, do the other side. And then you're going to cross again, same thing, and now you're going to come in and hold, and you're going to feel a nice deep stretch. Again, make sure you monitor your pain scale, and you want to hold this for about 30 seconds on each side, holding on each side. So make sure you do that warm up first, just to activate the glutes. That's very important. The way that your glute muscles work in conjunction with your hip flexors helps to maintain the alignment of your pelvis, and again, keep you injury free. Next exercise you're gonna do is on one knee. You're gonna put one knee forward, and you're gonna lean forward until you feel a nice stretch right down the top of the hip, down the thigh. And again, you wanna hold this for about 30 seconds. Monitor your pain scale, nothing above 6 or 7. Nice deep breathing, keeping the rest of your body relaxed, and then you're gonna switch, do the same thing on the other side. Next exercise you're gonna do is lying flat on your tummy. Okay, you can put your hands wherever is comfortable for you. And you can rest your head down. And what you want to do is you lift and lower the leg. Lift and lower the leg. So let's move this to make sure you can see. You are head down, lifting and lowering. Lifting and lowering. So again, you get a nice stretch down the top of the thigh and the hip flexors. You're activating your glute muscles. So 10 to 15 each side, depending on how you feel. And again, watching that pain tolerance. Next exercise you're gonna do is actually your ankles, which have a lot to do with your hips. So we wanna make sure that our Achilles aren't tight, because that can cause your hip flexors to overwork. So we are going to walk on the heels. And again, monitor pain in your hip. You want to do this walking on the heels for about 60 seconds. So walking on the heels, 60 seconds. Next exercise you're going to do is lying flat on your back. Knees are together, ankles are together, and you're just gonna let the knees fall out. Boom. Let gravity pull them down. Let gravity just pull the knees down. Should feel nice and natural. Should actually feel, again, like a very good stretch. And you want to do 10 to 15 reps. And then come together And then you're going to try your best to keep your upper back and middle back flat on the floor. And you're going to keep your knees and ankles together the best you can. And you're going to let the knees fall to one side. Your lower back will come up a little, that's okay, but you don't want to twist through your torso. And then you're going to fall to the other side. So you might feel like the side that the hip flexor is strained or you have pain might feel a little harder to do, and that's okay. Just watch that pain tolerance. And you're going to do 15 on each side or 30 all together. And then that is it. Super simple. So again, hip flexors, you got a lot of muscles there. So you want to make sure that you are doing stretching every single day to ensure that you can prevent injury. Under 7 minutes, you can do it twice through.